Well, a lot of us do a lot of sedentary work. We're at a desk a lot of the time, and we don't necessarily have pain, but the world is built now to, you don't have to get up to do many things. You don't have to get up to get the remote to change the channel. You have your phone, which controls everything. You don't get up for lunch or lunch is delivered. You're not walking to lunch. You got somebody right at your door to give you order if you're ordering lunch. And, meetings, you're not going to a meeting. Your meeting is right there. So by nature, over time, that sedentary activity can cause you to have poor health, poor posture. Poor posture can lead to increased risk of falls, poor muscle strength, weakness, loss of muscle mass. And a healthy person who was active, just sitting on the couch watching a few more movies, can, after 3 months, start to show on examination a little bit of muscle loss. And so you want to think about, if you're just not moving enough, and sometimes it's not just the walking, it's the actual strengthening exercise that you do, you're putting yourself at a loss. You're going to be bankrupt by the time you're done.
What if physical therapy was not just about recovering from injury, but about preventing it in the first place and being able to thrive in life? Today on WellWaveNOW, we meet a practitioner who's redefining what physical therapy can do and who it is for. Our guest today is Dr. Gina Williams, Doctor of Physical Therapy and CEO of Mobility Health Physical Therapy. With over 2 decades of experience and a pioneering home-based model, Dr. Gina helps people recover faster, move smarter, and stay out of the surgical suite. She has been featured on ABC's Good Morning America. She's a trusted voice on movement-related health and leads a team dedicated to delivering personalized physical therapy to your door. Whether you are an athlete, an aging adult, or a professional sitting at a desk all day, Dr. Gina brings a bold new vision for what physical therapy can be.
Hey, welcome to the show, Dr. Gina. It's great to have you on.
Thank you so much. Pleasure to be here.
Yeah, excited to jump into this, learn more about you and what you do. And when most people think about physical therapy, they always think about it from the recovery angle, right? You've had an injury. I mean, every time I've been to the physical therapist and every time I've taken a kid to the physical therapist, it's always been because of some sports related injury, right, that they've been involved in. But Dr. Gina, you're going to kind of open that up for us and help us realize that it's more than just for injury, right?
It's more than just injury. I mean, there are thousands of studies that are so many years in the past 10 years are proving that just having a religious or continuum of regular daily exercises as part of our normal routine is beneficial to all of us, no matter what age we are. Even if you've never exercised in your life, some form of movement and strengthening you can see drastic change and improvements. And so often with some of my patients who come for an injury, that's what brings them to physical therapy. Once the injury is healed, so to speak, we talk about how to prevent them from coming back to physical therapy and how to learn about their body. And so an injury is sometimes our body telling us something is not even or strong enough, and that's why the muscle strained or that's why the bone broke. Sometimes it's something that we haven't been doing in our lives for our body that causes us to have that weakness that then turns into an injury. So when our body is talking to us, we have to just listen to it and make sure that we're making actionable plans to keep our body healthy with moving and exercise throughout our whole lives.
Well, that was quite a bit there, Doctor. Doctor, yeah, in a minute, I guess we may just be done here.
I was going to say, any questions, Tim?
but coming from that, so that movement and that plan for life and all the health you've got there. We talked about, Breck talked about, we had taken somebody for rehab, and I did my home care days. I used to do home care for the elderly, and so rehab after hips, after breaking a hip and other things of that nature. But what are you seeing as general out there, the biggest misconceptions about people have in general about physical therapy?
Well, people often I find that don't have a great experience with physical therapy in terms of an expert-minded movement forward therapist. They think it's for somebody who's older, debilitated, can't move, and then you're holding their hand and doing very simple exercises, and then you sit them back in a chair. And so that's not what physical therapy is about. You meet the person where they are at that time if they're having difficulty walking, but the goal is to get that person back into the community, moving, or hiking if that's what they need to return to. It's a continuum of talking about on day one, what is your life goal? Not, oh, I just want my knee to stop hurting. It's why do you want your knee to stop hurting? And then you peel away the layers and get that person back to thinking about their life and not the pain. Also is even more therapeutic for the mind and helps release healing endorphins and hormones to help improve healing of the body.
Yeah. Would you say then your practice really is emphasizing prevention and strengthening and mobility rather than, the rehab side of physical therapy?
It is prevention, and it's also preventing you from injuring yourself again and giving you, the patient, the tools to understand what your body is telling you from a therapy mind in terms of, okay, well, I feel pain. Is that the same pain that you cause you to be injured while you're in physical therapy? Or is that pain delayed onset muscle soreness from your muscles actually growing and getting stronger, and giving the patient the tools to understand what's the difference, when is too much, what should a good exercise feel like, is the plan to help them move through their life independently without having to go back to the physical therapist if nothing in per se is particularly injured or wrong, but understanding that, the body is able to heal and giving them the specific exercises to progress as well.
Yeah. Dr. Bob is always telling us, engage the core, tighten your stomach before you do any lifting, right? So is that part of what you're doing is different techniques to do the movements that in my case, it's taking my kids because of an athletic injury. It's to prevent that injury from happening again, right?
Yes, and often patients come in and they say they've heard that term, engage the core. I've heard that all my life. I'm trying to do it, but I don't know what that feels like. And where's my core? The core is essential in all movements, even in tests of showing just moving from sitting in a chair to standing up. The core muscles actually activate first before you actually lift up out of the chair. And so it's essential. If you have a strong core, the whole body has less stress and strain to move. And so understanding, showing the person where the core is and telling them how it should feel, how the spine should align while activating the core. And once they have that feeling of what it feels like to activate, they will remember that. The body will remember that. And shortly after, you'll be getting up out of bed and you're feeling your core engaged like you've never felt before. You've probably gotten out of bed for 50 years, but not until somebody really identified the key points did you start to feel it activate.
That's
Yeah.
one of the key. That's one of the
All
most
right,
important
I got to
things.
step in for a second here. So to our audience, our live audience, apologize for this a little bit, since this is a new technical platform we're using to try and enhance what we bring to you, especially on the replays. But Dr. Bob, it says you've got multiple tabs open with this platform playing, that you need to close it so that we don't close the other tabs so that we don't do anything.
Okay, everything's looking fine right now, but does it not look good to you?
Right. No, but all it says, Bob, is you got the Riverside open in other tabs, and it needs to be closed in those other tabs to prevent difficulty.
Okay, I'm looking around for them and see if I can find them.
So welcome everybody that's joining live here on TikTok and Facebook. Thank you for joining the WellWaveNOW show. We'll be right back to the show in just one more minute. Yeah, thanks for joining the live here on the WellWaveNOW show. We have the amazing opportunity to talk to Dr. Gina about physical therapy today.
All right. Well, let's go ahead and move forward. Hopefully we've got it taken care of. So again, apologize to the audience for that inconvenience, and to you, our guests also, Dr. Gina, on this one. But we want to make sure that what you say that gets captured correctly for the replay as well. So we need to take that little stop to move forward here. But yes, Dr. Bob.
So, Dr. Gina, what you said before was amazing, and it's really important, in my opinion, because people have core muscles that can work pretty well. They're just not coordinated, and I'm imagining what I took away from what you said is that you're helping them coordinate them and get them to activate when they need to activate, right? So,
Yes.
because getting in and out of a chair, if you're not contracting your core, then your back is doing all the work, and the back is going to get pissed off,
Yes, it's going to start talking to you.
Exactly. Same with sitting and standing, bending and reaching. It's pretty wild. So I really loved what you said about that. You're teaching people how to. It's almost like corralling the core to make it work for you instead of not working at all.
Yes. And, I don't discriminate. I have some, patients in their 70s and 80s that say, oh, I'm an old lady, give me a break. And it's like, no, well, the body, you have to move, and you have these specific goals, and these specific goals require these list of things, and we're going to meet you where you are, but we have to progress every time we do things. And sometimes I get stares from, some trainers in the gym, and they come up to me and they come up to the patient and say, well, I don't think she should be giving you that exercise. And stereotypically, it's an exercise that somebody who's 25 should be doing, and the patient is 60s, the 70s. And it's like, these are the exercises you want for longevity and movement and health throughout your life.
Right. And I think the way you're using longevity is the way we like to use it. That it's not just about having years. It's about having years that you can enjoy and that you can have full function and walk into it. Dr. Bob and Breck have heard me say this one before. It's called my Moses plan, because biblically Moses lived to be 120, and which, in Genesis 6:3 or 3:6, I often split them up. That's what it says. My spirit will not contend with man for more than 120 years. So it should be 120 years. And at age 120, he was able to climb the mountain the last day. And it wasn't climbing that killed him. It was God said, "I just had enough of you." So those people in their 70s, that's really should be just middle age, and they ought to be doing that. They ought to be performing like people in their 30s and 40s do on average, chronologically today. So I'm with you on that. And just one other little comment. That's part of what I saw in my home care world, where I saw that year I'm dealing with people 79 to 90 for the most part when I did that. And I saw too many people give up on them. But with the right approach, I saw they could get better. And so I'm glad that you've got that you've developed that right approach in many cases, Dr. Gina. Go, Dr. Bob.
Yeah. So people who you see finally, after all the decades of the stuff they've been doing to themselves has been messing them up, and they finally get to you, and then you're going to help turn it around. So they've spent, let's say, some of them decades doing all these movements inappropriately and not taking care of themselves from a neuromuscular standpoint. How long does it take on average for you to turn somebody around? Obviously, if they've been doing something wrong for 3 decades, it doesn't take 3 decades to turn them around. But so, what would you say on average, if somebody complies with what you want them to do, how does it take to turn them around and get them, out of their discomfort and back to moving in a functional way?
That's a great question. And patients often want to know that day one. And good thing I got 2 decades of data to let them know exactly, based on your diagnosis and things that you're talking about and your goals, this is what it takes. And now I start to notice things are changing at visit 3. And so frequency is important. So I often say, if we're going to start, we have to do minimum of 3 times a week. That's the minimum. 3 to 4 times a week is best to see the most actionable change. There's dozens of studies that show if you do physical therapy once a week for 6 months, you're not doing anything. It's not even maintenance.
Yeah.
But studies that show patients who do therapy at least 3 times a week, you have a 93% chance of getting better. And now, to answer your direct question, I see after the first 3 visits, but the patient starts to see it after 3 weeks. They say, you know what? I don't know, want to say something. Maybe it's too soon, but I'm noticing a difference already. And then I smile, because the 3-week of consistency is a turnaround. Like 21 days. It's something about that time frame that the person actually sees. My husband said I'm moving a little bit better. My daughter said I bent down and it looked a lot smoother. I'm walking differently. But on average, most patients get a bulk of the therapy within the first 3 months, and they start the pain starts to go away in month 1. Month 2, we're working on mobility. Month 3, strength. And after that, we're just working on the fun stuff, just moving through life. And hey, okay, now let's work on picking up heavy grocery bags, or let's work on doing a push-up. If that's your goal. And so it's really fun to see that once somebody commits to the consistency, the change is drastic, and it doesn't matter the age. I even had a client, she was bedridden because she, had COVID, and she was sick in the hospital for a few weeks. She was 93. She was walking before she was bedridden, and there was still muscle strength in her, even though she wasn't able to move. So her children, God bless them, and the full-time aides were able to give her the exercises that I was giving her while I wasn't there. And I saw her 5 days a week. And even dressing the person, you don't say, hey, let me put this on you. You ask them to help, even if they couldn't move. That thought really helps activations in the muscles of the body. And after 3 months of consistent physical therapy, she was able to walk from her bedroom to the living room to watch her stories on TV. From being a bedridden, I was brought in to show the family how to lift her out of bed with a Hoyer lift machine.
We had a recent guest on, a Harvard doctor, that specializes in longevity, and encourage everybody to go back and listen to that episode. But she made a point that you just talked about. This patient had existing muscle that was there, and Dr. Josie talked about that's our bank as we age. Muscle is our bank, and if we don't have muscle, we're bankrupt. And so I also gauge, the success of a PT, a physical therapy appointment from my own experience or my own kids on how miserable they are afterwards. I know that's a really good physical therapist if they come out going, oh, that was just the hardest work I've ever done, because I know that they're getting what they need to get out of it.
That's so true. That's funny. Yes, it's about reaching the goal, not being best friends.
Yep. Yeah. If they want to help spa, they can do that on their own time, right?
Yes.
So we touched on a lot of things, the recuperation, the rehab part, bringing people back. But there's also, I think, work you do that's important that's on when I call it prehab, the preventative, the performance portion of things on that. So, and that gets back to your discussion to me a little bit, ties in with your longevity on that. So if you would kind of share what kinds of issue or risk people can address with physical therapy before they experience the injury or the functional decline. What does it bring to the table in general, and then also position it a little bit against just general personal training and general exercise?
Well, a lot of us do a lot of sedentary work. We're at a desk a lot of the time, and we don't necessarily have pain, but the world is built now to, you don't have to get up to do many things. You don't have to get up to get the remote to change the channel. You have your phone, which controls everything. You don't get up for lunch, or lunch is delivered. You're not walking to lunch. You got somebody right at your door to give you order if you're ordering lunch. And, meetings, you're not going to a meeting. Your meeting is right there. So by nature, over time, that sedentary activity can cause you to have poor health, poor posture. Poor posture can lead to increased risk of falls, poor muscle strength, weakness, loss of muscle mass. And a healthy person, who was active, just sitting on the couch watching a few more movies, can, after 3 months, start to show on examination a little bit of muscle loss. And so you want to think about, if you're just not moving enough, and sometimes it's not just the walking, it's the actual strengthening exercise that you do, you're putting yourself at a loss. You're going to be bankrupt by the time you're done. It's like a bank account, Tim. Like, if you're not putting money in every week, you're not going to have anything at the end of the year. At the end of 10 years, there's not going to be any accrual.
Yeah, so true. So true. So Dr. Gina, without naming any names, let's stay HIPAA compliant here, but can you give us some actual examples, some stories of patients you worked with PT that, maybe you even kept them from having to go get surgery?
Oh, yes. So, sometimes a person gets diagnosed with, my doctor said I have, moderate arthritis, and I may need a knee replacement, soon. And, I'm coming to physical therapy for prehab, before he does the surgery. And so many studies show, mild to moderate arthritis, totally rehabable. It doesn't mean that you have to eventually get a knee replacement. So what you do is we work on muscles around the knee, work on the quads, work on the hamstrings, work on their balance, check the ankle strength. Could be a postural issue where they're putting pressure on one side versus the other, look at their gait. And after about 3 to 6 months of doing the physical therapy, the knee pain is gone. The person's back to their jogging, they're back to everyday life. And they're like, okay, well, I don't think I need the knee replacement anymore, but if the pain comes back, I'll talk back to my doctor. But it's like, whoa, they have that almost like a death sentence. Like, oh, the surgeon said I needed this, but I'll try this one more thing. And then it ends up working. They're like, oh, wow, good thing I didn't just go do the surgery first.
Yeah, that's excellent. Other patients that come to mind that might have been, headed down an atrophy road to maybe going into even a wheelchair or a walker, that you've been able to reverse that muscle atrophy?
Well, there was a person who did have some spinal dysfunction. It was chronic. She had it for, 10, 20 years of, finding the right doctor and moving around. And she was using a cane, and she went to a lot of physical therapy places that didn't give one-on-one care. And so she had a bad taste in her mouth about whether physical therapy would work. But, I educated her about, there's differences in care. And if a person only has 5 to 10 minutes to work with you and talk to you, there's not going to be much value for you individually. And so she trusted me, and we worked on exercises for her core, her posture, and we were able to take her off the cane, which she'd used the cane for about 5 years and was losing balance. And now she could balance and stand on one leg. But, we started small. At first I had her just, if you're cooking in the kitchen, just while you're at the kitchen counter, stand on one leg while you're cutting up those carrots. If you're in the bathroom, brush your teeth, the time it takes to brush your teeth. So you should be standing on one leg, doing your balance. When you're sitting down on the toilet, try not to get up by pressing down on the side railings that she had installed. Try to use your quads and your hamstrings and your legs to push up and stop assisting yourself throughout your daily life. And gradually things came along.
That's an excellent example. I appreciate that. In the next segment, we want to kind of do a comparison of physical therapy versus personal training. But before we jump into that, I want to take time out for a quick sponsor break. Are you tired of painful injections or expensive prescriptions? Do you want to lose weight naturally without the hassle? Well, introducing Brain IQ Fast Melts. This revolutionary way of shedding some pounds is effortlessly done and in less time and with less money. So it's less than 1/4 of the cost of traditional GLP-1 prescriptions. You can lose up to 28 pounds in just 10 weeks on average, without any of the negative or bad side effects. The leading prescriptions take about 40 weeks to get similar results. And of course, they do have some side effects you need to be aware of. So outperform the leading GLP prescriptions, lose more weight in less time, say goodbye to long wait times, and hello to faster, safer, smarter ways to reach your goals. Don't wait. Choose Brain IQ Fast Melts and start transforming your body today. Available now, because your journey to a healthier, happier you starts here. We'll leave a link in the show notes. So in our next segment here on the WellWaveNOW show, we do want to discuss those differences, right, of personal training, versus physical therapy. We kind of touched on them a little bit earlier on this segment here, but we want to kind of really uncover it today and in this next portion, and really kind of understand what are the differences. So general fitness versus a clinical therapy approach to what you do, Dr. Gina.
Well, there are many great personal trainers out there, and I often refer to many of them once patients are done with the physical therapy aspect and they want to get back to their normal routine. However, a physical therapist, especially a doctor of physical therapy, is a graduate degree. I went to 4 years of pre-med school and 3 years grad school, and that's just to start with. And then you have your clinicals, you work in hospitals, and you work alongside doctors. And so it's extensive training to go with. And it's specifically individualized care. We're not giving you a cookie cutter exercises. Oh, these are how you work your hamstrings and your quads. We are editing in real time in terms of how your body moves, your frame, comparing your asymmetries, and can adjust things in the moment to say, okay, well, this hurts my knee. What else can I do in a different way to still strengthen that muscle? And we'll go right into that mode of putting, okay, this is for Sally's exercises. I know her knee hurts when she shifts forward. Let's have her push back a little bit, but do a little less weight. We'll know how to progress you and understand a little bit differently. It's more of a prescription of exercise edited for each individual client and their specific health needs.
Yeah. So if somebody's already really active, very physical fit, maybe they already work with a trainer, would they still get benefit from physical therapy?
Oh, yes. Often we get referrals from the personal trainer saying, I'm working with this client. He really wanted to get his back stronger. We're not getting any results. Can we all come in and look at this client and see how we can get those results? Because there's a piece missing. And it could be like postural chain exercises that we work on and talk to the trainer and the patient. And we work together to get those goals solved, because no one knows everything. And so I really respect those trainers that come to us and advice to help their client move further into their goal.
Right. So I like that part where you talk about fitting in that piece of the puzzle. I've been sitting here trying to figure out how to frame one of my pet peeves without it being a leading question. And then I decided that with you, Dr. Gina, because I know that you're just going to speak your mind anyway. I don't have to frame it that way. But so let's say somebody comes to you and they've got they're coming for, and then this is where we're getting in the rehab portion. This is even more than the preventative another part. But let's say they had the elderly person, they fell and they broke their hip and they've come to you for that, but then you realize they have no grip strength. But what do you focus on? What do you do with them? So
Well, you got to move. So the primary injury is going to be the hip injury that we work on. But ideally, you cannot complete your daily life task if your wrist has no grip strength, grabbing and taking things. How are you going to hold that cane if you have a hip surgery? Because sometimes you have to have a cane or use a walker to walk, and that's going to affect your mobility. So ideally, when someone comes in for care, yes, we look at the one area that they're talking about, but it is the total body. It's the posture, it's the head to the toe of what's going on, because over time it could be something that you're doing over time, maybe putting pressure more on that right hip, and you, when you fell, you leaned in that direction, or something that may have predisposed you to an injury. So always taking a look at the person as a whole and what's going on. It's not, we would never say, oh, well, you're here for your hip, I'm not going to look at your wrist, because all parts of the body affect how we move through life.
Right. Now, that was a leading way. That is one of my pet peeves. One of the things I used to see in that home care, and even more recently, once I get out of home care, I'm going over to show a pulse electromagnetic field therapy device to a woman who's probably in her 80s and having some pain. But she's had a hip problem. So she's had physical therapy coming in for her hip. Yet I see she can't turn over. I see she's got no muscles develop, and I'm saying, why in the world are you there? I said, what do they have you do? And she said, well, they have me do this or that for the hip. And that's it. Now, and so that is one of my pet peeves. And why aren't they addressing, how can you even address that one area adequately when the rest of the individual is failing?
Well, to be fair, physical therapy is a business, and there are time constraints. Said therapist may only have 20, 30 minutes to work with Mrs. Jones and then move on to their next patient. And if you're working in a busy outpatient clinic, there are many that were in New York City, a little less now, but you'd have 15 minutes to work with each patient. And so if they're complaining about another body part, what do? 5 minutes one part, 5 minutes the other part? It's really not possible.
That's not possible. But they should have been, just like the physical, to me, in my mind, just like the personal trainer referred to you because that was one issue on there. They should be referred to others, and at least the option to at least to be able to do more work and broader work should be there, because just not. And I saw that to your point, and I often thought it was perhaps because of insurance or because of focus and things, but I saw of that nature. But I saw that very, very often. I got you, Bob. Very, very often in that home care world, where they're coming in, that they're doing rehab on the shoulder for someone and nothing for the rest of the person, and not even recommending anything, that the person look for other things. So I appreciate you sticking up for your colleagues, but I also like the way you've articulated how you would approach it. And I think it's a different philosophy and a different approach there. Dr. Bob?
Well, yeah, Dr. Gina, I'm really upset about how physical therapists have been maligned over several decades because they don't get the time they need in general with patients. And it's terrible because you guys are highly educated. You go through a lot of schooling, and then they throw you in with a patient for 15 minutes or 20 minutes, or have you seen in an hour seeing 4 and bouncing around from one to one. It's just, to me, it's absurd. And I think that's something we have to fix in the conventional care system, because we're not taking advantage of physical therapists as a resource. I did clinical trials years ago with physical therapy compared to some alternative therapies. And, the alternative therapies that the people were paying for, they got an hour, whatever, hour and 15 minutes. And the physical therapist got 15, 20, whatever it was. It was terrible. It's not a totally unfair comparison. And so I just think that we got to somehow fix the situation. It's almost like, earlier on, the pharmacists were not being taken advantage of. Now, due to some of the work that Breck's doing, community pharmacies, the pharmacists are going to really be helping out because they know a lot about drugs. They know more than most docs about drugs, right? And you guys know so much about rehab, and we talked about. I think that you guys should be seeing people even when they're not hurting, because you can spot. I think you guys can spot what's coming down the pike for a person when you watch them, look at them.
Yes, actually, and sometimes a group of physical therapy friends and I go to dinner, and so it's hard not to watch people approaching us like, oh, look at that one, probably had a hip replacement. Oh, look at that ankle, like they were limping, and kind of assessing as we see people through the world. And so it's part of that. But the shift comes from, physical therapists who want to see a change, who know that, they have so much tools that they can help people with. And also, us being a patient, not taking that, substandard care. And the more people, come out and say, hey, this is not acceptable, the less people will pay for that, the more they'll realize that taking your health into your own hands is the most important thing that you need to do.
Yeah.
Correct. And that's why I say, so I appreciate you, Bob. Bob always likes to stick up for our guests too and put in it. And so
Only when it's warranted, Tim.
I appreciate you
I don't
sticking up
blow
for the,
smoke. I'm telling you, man.
sticking up for the, the occupation. But to the
Somebody
point
goes to
there,
school for
just
somebody
to
goes
add
to
it
school
there.
for.
Hold on, I'll put what's point there. Just like the side note, we did with my sister, for example, who had a lot of problems, and it was because of her physical therapist. Physical therapist said, "Look, I've got this limited amount of time to help her. She needs a lot of other things here." Needs more here, and this is what needs to be done. But you guys would have to come out of pocket for it. And so we got together and pooled our money and came out of pocket for it. But if that physical therapist hadn't brought it to our attention, it wouldn't have been done. So
Right.
that's my point.
And I'm not sure if physical therapists who are working in some institution are allowed to even do that. You can private
Oh,
pay it.
this was with a very well. This was in California, and this is with a very very well known. I don't know what you can call them, PMO. So yeah, it was an institution, and it was like that. And then we came out of pocket and we paid additional for it. But that's it. But to your other point, one thing I want to make sure we touch upon here, and we've talked a lot about injury and some pain and what you've seen, joints issues. But there's so much more that I recall my wife having something originally. At one point, they thought she might have had MS. Luckily, it turned out not to be MS. It was a pinched nerve. But they sent her to physical therapy for that pinched nerve, and it was addressed, and she hadn't had that problem anymore on that. So there's such a wide range. I think. Well, I want you to talk to, if you would, Dr. Gina, sort of the range of things that we may not think of physical therapy for naturally that it exists for it, like for even Parkinson's, even MS, even pinched nerves. What's that world that you address?
Well, TMG, jaw pain, vertigo, also, mild discomfort in your neck. Like some people kind of normalize that. Oh, my neck's hurting again. It's just, I'll just stretch it. No, that's not normal. That shouldn't be normal. Our body should feel free. We shouldn't have any mild chronic pain in our bodies. And that's an easy fix for a physical therapist to take a look and assess you and see what's going on. And that mild pain add 10 years to that, it's going to lead to something that's probably not as easily fixed with physical therapy. People often think of, like if you sprain or strain something, it heals after a few weeks of just laying off of it. But there might be some weakness issues why you're spraining or straining your body. And just getting an assessment from a physical therapist can actually even change your mind frame, especially if you're someone who knows about working out and works out, but they can give you actionable tools of preventing those strains from happening if they're happening, 2-3 times a year. Or sometimes people who, my back gives out, maybe 2 times a year, my back gives out, but it gets better. But I know it gives out and I just rest for 2 days and then it gets fine. That is a problem. Over time, you can end up with a herniated disc. You can end up with even more pain, discomfort that takes longer to get better. Instead of 2 days, it gets better. You'll be out for weeks. And so consulting with a physical therapist can help it from not giving out every once in a while, ever again.
Yeah, I'm wondering, like, if let's say I don't have chronic pain right now, but I would love to come in for an evaluation. If I came in and said, "Hey, look, I get every now and then I wake up, I have a little bit of back tension, I work at the computer, I have a little bit of neck strain, not a big deal." How would you evaluate me? I think people should be coming to see highly trained physical therapists for evaluations on, future visioning of like what's going to happen. Like, okay, what do you do? How do you evaluate?
Well, you look at posture, there's strength testing, there's balance testing, and just looking at you, Dr. Bob, I can tell that back pain is probably right side justified, probably have it on the right side of the neck, right side lower back is usually more a little bit tense because your posture is a little bit different. That shoulder's a little bit higher. And am I right?
I was just going to say I made all that up, but
okay.
but in my history though, no, but really, so you notice.
Well,
that,
not having, may not have. You said you don't have pain right now, but just thinking about the history of where it was when you did have that pain, the likelihood of it being asymmetrical is very possible based on the posture that I see you have sitting here.
Perfect. Right side SI joint was painful for quite some time. Years
ago. How do I know that? I'm just looking at you on the Zoom call.
Yeah, I'm so glad you're here, Dr. Jim. You're giving Dr. Bob's of his own medicine. You know how many times we've had a guest. For example, we had a guest come on one time who had been in a car accident at age 17 and brought themselves back and talking about how well they had brought themselves back. And Dr. Bob said, "I think you still have some problems because that right shoulder sits up there harder than that left one."
Well, I've been watching people for 30 years. The thing that really changed my life was a gentleman named Paul St. John did a walking video, and he did it on the beach, and he was just filming people walking by, and he was narrating all the crazy dysfunctional walking patterns on it. And then from that moment on, I've been watching everybody walk, because you can see how crazy it is, how dysfunctional most people's walking patterns are. I'll stop there, but I just wanted to.
Well, I'll add that I always have better posture when Dr. Bob is on, because, yeah, I always try to, keep a little more straight up and down in my seat. So,
Yeah.
So,
And Tim,
this whole
your
this
neck
whole
is
thing
so
about
far forward, you're gonna start having the allergist hump on your back. I said, "Why, my neck's for Dr. Bob, so I'm just so eager to hear you talk."
oh, that's it. Okay, I'll let that one go, Tim. But anyway, so I think that using physical therapy for a preventative or future visioning of how things might go for somebody, when you check walking pattern, when you check balance, when you check all these different things. I mean, when I work with somebody, I just say bend over at the waist to try and touch your toes, don't strain, and then just hold yourself there. And every time I go to put my hand up into their gut, it's soft as can be, no contraction of the gut. So
Wow.
these are, and then I say, okay, flex those abdominal muscles, and then they can do it. They have plenty of strength there. It's uncoordinated. So I love what you said about helping people coordinate their use of their muscles. Really great.
Yeah, now I think Dr. Bob started down this path by saying, he didn't have any problems. I would disagree. Dr. Bob's got tons of problems, but
Well, most of them are when I'm on the podcast with Tim. That's when the
but he said if he could come in for a sort of just a screening with you, and that just brought to mind here. Do you do screenings? Because I sit there, right now. I rely a lot just on my exercise routine. So I go and I'll do my resistance training 3 times a week. I'll do my stretching 4 times a week. I swim 3 times a week. But I still pop into mind as we've talked about, hey, these things could be preventative and other things you can spot down the line. Am I and others just relying too much on that exercise or even personal training too much? Can someone come in and just do a screening with a screening with you that you might take them through and provide some thinking?
Yeah, especially someone who's got a good varied exercise routine. Getting a screening from a skilled physical therapist can really help hone in your skills. Like, okay, so what's really going on? So if you've been doing these strengthening exercises in the gym, what specific exercises? And it's like, well, you've been doing a lot of quad exercise, but your quads aren't really as strong as they should be for someone who's been doing 3 to 6 months of this exercise. Let's peel that away so you can really get the benefit of the exercises you've been doing.
Fantastic. I was just thinking, I think that, everybody goes for wellness visits and they take blood and they take blood pressure and blah, blah, blah. They do all that stuff. But why couldn't somebody, as part of a wellness visit, go see a physical therapist? I think that, everybody's got physical therapy benefits. A lot of people do, because physical therapy is like the first line of defense when somebody has some kind of chronic pain situation. Why couldn't somebody go to physical therapy for a wellness check as part of their annual wellness visit?
They should, and many clients do, but they pay out of pocket for it because they understand the necessity of it. And sometimes it's once a month checkups, editing their exercise routine, making sure that they're keeping up. It's accountability as well. And once somebody's checking up on you, all of a sudden you're doing it more.
That's true.
Yep. Yep.
So we went into that, and so I want to wrap in our last segment here and wrap it up with some clarity here, where we just talked about, in general, people should come and check in with you and see a physical therapist as part of their overall wellness planning. And I think everybody should have an overall wellness plan for themselves. This should certainly be a part of it, and I'm glad you're bringing this to the forefront. Who else, even in pain or not in pain? Who else should be coming to see you here? I'll give you this. I will ask, and we'll put more leading into it, for example, because you even do postpartum physical therapy.
Yeah, so women who having difficulty getting back to themselves in terms of having some urinary difficulties or difficulties lifting the baby, or still having pain is 3 months out from holding the baby. That shouldn't be. And sometimes many of our clients have said, oh, I went to my doctor and they said it'll go away after a year or so, and that's not normal. And sometimes it's the practitioner who don't have the direct connection to the pelvic floor physical therapist. But yeah, we help many women, and sometimes it's not even come for 3 months. You just had a baby. Where you want to go? We've treated women via Zoom, sometimes 3 sessions to help decrease their difficulties with going to the bathroom in 3 Zoom visits.
Nice.
Wow, that's amazing.
Okay. Before you go down that path, Dr. Gina slipped that in. I know she had to make that point before you go that far, but it was a good one because I would have forgotten to bring this up because she's very much at the forefront of kind of remote physical therapy and telephysical therapy. So talk about a little bit more when you talk about when you mentioned the Zoom and how you approach that and how that's worked for you and for your patients.
Well, there are thousands of physical therapy assessment tools that we use that it's not actually physically touching the client. Like Dr. Bob was saying, ask the patient to bend over, and you're looking at symmetries, continuum from left to right side. You're checking balance. You're looking at their range. And just like I could see Dr. Bob's posture is not even, it's the same way that you see it in the Zoom visit, but really analyzing, assessing, and, have them back up and you see their whole body on the camera. And this is something that's been done, for the past 25 years by physical therapists via Zoom, but the change of the times, the pandemic brought it more to the forefront. But 10, 20 years ago, insurances were actually covering telehealth physical therapy because they knew that it works.
Well, during the pandemic, right, there weren't face-to-face visits at a lot of PT offices. Have you seen that technology? I think it's called CareSpace. CareSpace. That actually is a virtual PT appointment where it puts a wire frame on the patient. You have them walk. It measures their gait and all those things that you're talking about visually seeing. The AI is actually calculating. Have you seen that technology before?
Yeah, I've seen that technology. It's a great assistant and a help. But I've tested some of my therapists and that I know, and the findings are actually on par with our visual assessment. So it's really good to know that the AI is meeting what the therapist is saying, and so it can help as an assessment tool. Maybe something that's not picked up, then you can see, okay, wait, look at your gait here. It's a little bit less pressure on one side, and it can help us even more finalize and make individual exercise program for each client.
Yeah. And I think what really impressed me about that technology was that, just for instance, a deep squat as an example, it would actually, let them know what percentage of the squat they were down, so they knew, okay, now I need to go further, which is usually what the physical therapist is telling them to do. But they could see that on their own screen that, I still have 20% more I need to dip in this deep squat.
Yeah, so it'll help them understand where they need to be a little bit easier.
Yeah.
All right. So we talked about the remote population in one category. We talked about postpartum females and challenges on that. Back on, and we've touched upon some of these other groups before in our discussion, but I just want you to bring some more clarity to it. How else can physical therapy be used to support other groups such as the working professional, the older adult, the older athlete?
So there's a lot of balance exercises that can be done as well, for if you're older, just to make sure that you maintain your balance and your muscle strength and your mobility. For those who are, sedentary workers, if you're working desk work, there's exercises for Zoom fatigue for just your eyes and your facial muscles to help loosen things up. And eye strain and neck pain are so tied together. And so if you're, on a Zoom call for 3 to 10 hours a day, that puts huge pressure on your optic nerves, your opticals, and that directly affects the top of the cervical spine.
Wow.
I got a question for you. I'm really fascinated by this conversation. So here's my question. I don't know if this is, what's the most surprising result that you've had anecdotally with the patient where you were not even sure you could see a result? It was an unusual diagnosis, maybe not chronic pain, maybe not whatever, but yet you got the result and it just shocked you. You got anything like
Well, actually, most recently, I mean, often, especially in New York, you start seeing the patient right away. You don't necessarily need a prescription to start seeing and practicing treating the patient. So it was a, 87-year-old woman. She had severe shoulder pain. She could barely move her shoulder. Asked her to lift her arm, could barely move, severe 10 out of 10 pain in tears. And so, I said, whoa, that's going to be a challenge because it's debate is, do I have you go to your surgeon or do we continue the physical therapy? That's what constantly asking ourselves in the day one of, should we take on this client? It's not, okay, let's see. It's just, is this going to help you with physical therapy? And so I decided to take her on, but still it was a challenge. And then a couple weeks later, we got the MRI results. It said that she tore 3 of the 4 muscles in her rotator cuff. And now, if I seen that on day 1, I might have said, "Oh my God, I don't know if I could help you." But however, her last visit for physical therapy is Thursday, and she is back to ballroom dancing, and she's going to take a Brazilian tango class. You got the arm up there, and she's fine. And so it was a challenge. But I think if I knew she tore almost everything, I would have been like, "Oh my God," But she got better.
I think torn rotator cuffs are the biggest scam in the world because everybody's got some aspect of a torn rotator cuff. I've had so many shoulder injuries in my history. I'm sure if I went in with shoulder pain, they'd say, "Oh yeah, you got torn rotator cuff. We have to operate on that."
Well, hopefully.
Dr. Gina, you mentioned there in New York, no need to have prescription to come in to start. But now let's say, can Breck in how can you help Breck in Arizona? What's the scope? How do you want to help people in the across the nation, or if you do, or you just want to just share your knowledge across the nation and focus in New York? How do you want to interact with
Well, knowledge can be shared internationally in general, but in terms of specific physical therapy treatment, it can be across the U.S. because there's a Compact Act which allows a physical therapist to be licensed in Arizona. Specifically is a Compact Act state, so it's just a matter of paperwork. Once you're licensed in one state, you can treat in most of the states in the United States without having an issue.
Nice.
Oh, wow. That's very nice. So for our listeners that are tuned in today and really, trying to look at what key signs they should be looking for to prompt them to go see a physical therapist, even if they don't have a referral from a doctor, what are those signs that we should be looking for?
Any day you wake up and you say, "I can't do something physically," or if you're canceling dinner plans because you feel like you'll be uncomfortable sitting in that bar stool or those wooden chairs that they have in the restaurants, or if you want to get a ride directly in front of the place you're going and find a parking spot right in front of that area, that is an issue. You should be able to park anywhere and walk anywhere without consciously thinking about, "I need to be closer to the place."
Yeah, walking from a distance when you're parking in a parking lot is one of the best therapies ever, But I have one more question. What do you do? Because, I would say probably 80 to 90% of people walking on the planet have a forward head posture.
Mm-hmm.
And so somebody comes in with a forward head posture. What do you do to help them get their head back over their shoulders? I'm just curious.
First thing, get them on their stomach, and that automatically, it's a reflex. Even babies, you extend your spine once you're on your stomach. And then it's about building the shoulder muscle strength, the scapula, the lats, and eventually, even if you don't like to, the pull up, because that's essential. It hits so many muscles, it targets everything. And if you do it in line, you'll get, as a side effect, you might get ripped.
But you coach people on, like, when you're looking on your laptop, notebook, computer, looking down like this, 2 hours, 3 hours, 4 hours. That's a problem, right?
Yeah, so there's specific neck exercises that you work with resistance bands to bring that neck back. You build up the neck muscles so that then they actually hold your head up even better.
Nice. Very good. Okay, thank you.
So, Dr. Gina, how do people contact you if they wish to get more information or engage in a session with you?
They can contact me at mobilityhealthphysicaltherapy.com. There's a link with my direct email or the office email, office@mobilityhealthpt.com.
Awesome.
Cool.
Any other questions from our panel?
I got 1,000 questions.
We'll definitely have to have you back, Dr. Gina. You've been such a pleasure and a delight to have on the WellWaveNOW show. And thank you so much for sharing all your knowledge with us and kind of shifting the conversation too, from not just physical therapy being about getting better, but it's also staying strong. Working on that bank, get that muscle bank, right, for longevity. Yeah, so for everybody listening who wants to feel better, move better, stay ahead of the injury, this episode could be your turning point. So be sure and subscribe to the WellWaveNOW show and visit the wellnesswaveclub.com for more insights, tips, and resources. And always remember, everyone, wellness, it's in you.